Good afternoon, all. Every year, Alzheimer Week is celebrated in third week of September. This year, the theme of the year is No Dementia, No Alzheimer. This year, it has a special focus on post-diagnosis support. But before we dwell more into that, let me introduce you all to PHT's fourth podcast of Bridging the Gap. Hello everyone, I am Nimisha Kadam, COO of PHT Health Services. Today, on the occasion of World Alzheimer Day, we have Dr. Dhara Shah, a renowned neurophysician with 10 years plus experience in neurology field in treating all kinds of patients with epilepsy, dementia, headache and memory disorders. Hello Dr. Dhara, I heartily welcome you to our podcast today. Thank you so much for joining us today to spread awareness on World Alzheimer Day. In our journey for our viewers, we have covered important illness through our previous podcast. So today, doctor, through your expertise, we will share this platform for viewers to understand Alzheimer disorder, post support groups, and also how home care plays an important role in our daily routine of these patients. So, doctor, here we go. The most important and the commonly questions, but very important to understand, what is Alzheimer disease? What is the difference between Alzheimer disease and dementia? And what are the early signs of this disease?
Hello everyone. So basically dementia is an umbrella term for a group of symptoms, but mainly these symptoms are associated with decline in memory and thinking. So there will be memory issues in this disease. And Alzheimer's disease is just one of the types of dementia in which memory functions and language functions are the most affected and affected early in the disease process. So, overall, such dementia patients or memory disorders can have different types of declination in brain functions. So, memory being most important, I also told about language, but there are few other symptoms as well, like difficulty in managing complex tasks, difficulty in motor functions and coordination, means difficulty in walking, balance, sometimes personality changes. Sometimes this disease presents as a psychiatric disorder like depression, anxiety, and agitation. And as I told, the most important main theme is difficulty in retrieving memory.
Thanks, doctor. My second question would be, how long can a person function normally after receiving an Alzheimer diagnosis?
Generally, the life expectancy of any patient who has dementia is around 8 to 10 years. And dementia is generally diagnosed at stage 4. So there are basically 7 stages of dementia. And when patient comes to us, the patient is already in stage 4. And from this stage, for a rest next 2 or 3 years of his life, he can still work normally. But after that, most of the patients are not in a position to have a normal work in their life.
So, doctor, to understand this better, as you mentioned rightly, there are defined stage and progression with dementia.
Yes, so we stage dementia into total 7 stages. First 3 stages are often gone unnoticed. So these are cases of very, very mild dementia. So stage 1 is absolutely no memory deficit. This stage can be diagnosed only on investigations when patient has a strong family history of dementia in their parents. Second stage is very, very slight cognitive decline, like forgetting names in old age people. We think that this is a normal forgetfulness due to aging. Stage 3 is mild cognitive impairment, in which they keep on forgetting small things, like sometimes forgetting address of familiar places. Stage 4 is the stage when patients come to us when they have significantly forgotten something, like forgotten the address of their own house, or sometimes they have forgotten the face of their own family member. Then stage 5 is moderate dementia. Sixth stage is a very advanced stage in which they even have other difficulties, like uh, they become incontinent to urine and stools. Sometimes they even forget how to feed themselves, so they become fully dependent on their caregivers. And the last stage is very severe dementia, in which they are almost bedridden. They need assistance even to eat, to walk. They don't know when they pass urine or stool. So this is the highly advanced stage of dementia.
Thanks, doctor. For a better understanding, as you mentioned rightly, there are 7 stages of dementia. But for a layman to understand, are there ways to reduce the risk to getting Alzheimer diseases?
So, one of the theories of why Alzheimer disease happens is to maintain the vascularity of the brain, means the blood supply of the brain. So, as it goes with general health precautions, a person has to stop smoking if the person is at a higher risk of getting Alzheimer's or dementia. Minimum alcohol intake, aerobic exercises 30 minutes per day in a week, at least 5 to 6 days in a week, then balanced healthy diet with lots of fruits and vegetables. If patients are diabetic, they should keep their sugar levels to optimum. Then they should be socially and mentally very much active. So social engagement is a very good factor to prevent dementia. And involving in new learning is something which is coming up, like people who start learning music or singing or dancing or driving or getting engaged in some sports at a age when, I mean, we become little elder, so around 50-55 years of age, or engaging in new hobbies. This all will give some protection against Alzheimer's or dementia.
While understanding this better from you, doctor, we understand that for Alzheimer patients, there are quite support groups or there are various engaging activities in the community currently. But from the healthcare perspective, are the drug used to treat Alzheimer's symptoms effective, and what are their side effects?
So let me tell you, till date, there is no cure in Alzheimer's disease. We have lots of drugs available, but these drugs are not helpful in curing the disease, but we can slow down the disease. And there are few drugs which can be helpful for symptomatic benefit. Like if the patient has depression, we can give the drugs to reduce the depression. If the patient is having hallucinations amongst other symptoms, we can decrease down the hallucinations. And we have drugs which can slow down the progression, but these drugs start working only after 6 months to 12 months after starting the treatment. Unfortunately, there are no drugs which will prolong the life of such patient. They just improve the quality of life. And there are no major side effects of these drugs. Minor side effects like nausea, vomiting, decreased appetite, sometimes excessive sleep, headache, or dizziness can be experienced, but which are quite manageable with the intervention of the physician.
Doctor, while you rightly mentioned that there are no Alzheimer drugs for the patients, at times, if there are patients who are non-cooperative and don't engage themselves, so can Alzheimer patient be a danger to themselves or others?
Of course, yes. These patients, they can harm themselves. Like, we have many people of dementia who went missing out of their house and they could not remember their address and come back. So running out of the house, they can just simply forget to switch off some electronic appliance or the switch of the gas. Sometimes they can get hurt because they have forgotten how to use a knife or any sharp tools. So these are all the dangers that they can have for themselves. Harming others is little rare, but yes, few patients, they experience hallucinations in which they can see or they can have a firm belief that their own family member is causing some harm to them, and then in such cases they can even possibly harm the family members.
Okay. Doctor, according to you, what would be the best place of care at home or in the nursing facility for these kind of patients?
Our choice as a physician is always home care first. There are many advantages of being at home rather being at a nursing facility. The most important is getting the comfort of being at home and also the comfort of being within the relatives.
So I'm quite sure for these questions, whatever you have answered till now, there would be eagerness in the community to understand that if they have a Alzheimer patient at home, how do they need to make home safe and comfortable for someone who has Alzheimer?
So there is at least couple of dozens of safety precautions that one has to make. So we, like when we are expecting a small baby to come in our house, we do, child proofing. So we call it as, old age proofing for the patients. So you always keep a facility to keep the night lights on. Then We advise the patients to relatives to make a tattoo of their home address or at least some mobile number over their hands, so that in case they get lost, they are easily traceable. Then anti-skid mats in the bathroom are a must because they tend to lose their balance also in further stages of the disease. Railings in the passages, smoke alarms in the house. Then you should always lock the door at the night when you go to bed. Safety grills in the window, then shower chair in the bathroom. We should keep a habit of locking the electric appliances before going to sleep. There should be thermostat which should be put on the taps. Remove locks from the bathroom so that patient doesn't lock it inside and forget how to unlock it. So these are lots of do's and don'ts which we should do to make a home safe and comfortable for Alzheimer patients.
So, Doctor, here we in today's generation, what we feel is where maximum people at home are working, and there are very less people who are there to take care at home for these kind of patients. How does getting a home care service help or play a role in the Alzheimer?
So, as I mentioned, my first choice will always be a home care. So, patients will be most comfortable at home because when they come to a nursing facility, first thing is change in environment for them, which many of the Alzheimer's patient cannot accept. So, unacceptance of change in environment is one of the symptoms. So, at home care, people can, if there is someone who can provide care at home, relatives can still be free. Their burden of caregiving will decrease. They will be able to go to their home. Plus, we can have caregivers who can even tell the patient to do simple jobs like folding the laundry or keeping the utensils in the shelf, etc., which will not break a routine from their life, and their brain will be still somewhat active. They always have that facility of neighbors or distant relatives coming, joining them, playing a game with them along with the caregivers. So I think home care service is the future of management of Alzheimer's patients.
Thanks, ma'am. And we all being into home health care, according to you, what would you suggest the skills should a caregiver have while they are providing Alzheimer care service at one's home?
So before coming to the skill, I would definitely say qualities. First is being a human being. So once you are a human being, automatically patience, compassion, empathy, these all comes. Plus that caregiver should be a very good observer. First few days should be enough for him to observe what are the very close demands of the patient. you know so these patients are like small children. You have to understand what they want, give some love to them, and communicate in their language or as a body gesture, but it should be absolutely soothing and comfortable for the relatives, for the patients, sorry.
Thanks, doctor. So, as an ending note, what message would you give the family members whose parents or partners are suffering from Alzheimer? Any specific type of approach they should be following?
So, this disease is different from other diseases in which only the patient suffers. This is a disease in which whole family suffers. So, first message that I want to give to the family members is we really appreciate your efforts. You are very brave to give care to your family members who has dementia. Be gentle with your parents or partners. Allow them to open up to you. Let them know that you are there for them, but without being forceful. And comfort the patient with verbal and physical reassurance time to time. Always speak clearly and slowly, but in short sentences to them. And of course, always offer your love and care to the patients.
Well, that surely cleared a lot of information for us, and thanks for helping us bridge this gap. I'd like to thank you your presence here today. And since it's a World Alzheimer Week, let's work towards providing timely access to high quality post Alzheimer diagnostic support. Thank you, doctor. Thank you for your time.